RHB live countrywide on GSTV channel 912 and Go TV channel 301 has got you covered. Also live on 87.7 in Lusaka and surrounding areas. You'll be able to catch our programming on those platforms. Earlier on, I did say that we'll have the Center for Infectious Disease Research in Zambia CEO, Dr. 𝐂𝐈𝐃𝐑𝐙 𝐂𝐈𝐃 joining us.
All right, we're delighted to host you on the show. Good morning, Dr. 𝐂𝐈𝐃𝐑𝐙. Welcome to the Red Carpet.
Good morning, and I'm really happy to be here. Please do call me 𝐂𝐈𝐃𝐑𝐙.
Oh,
is it? Zuzu. Yes.
Oh, what?
Zuzu.
Zuzu.
Yeah.
Oh, okay.
We'll stick with Zuzu. I like Zuzu.
Zuzu. Okay, Zuzu is easier. I think most 𝐂𝐈𝐃𝐑𝐙s I've known are called Izu.
Okay.
This is the first,
Okay.
like Zuzu.
We'll do
Yeah.
Zuzu.
Yeah.
When did this start? Is it like from school or it's just something that?
From my parents, actually. I grew up on a farm called Shamazuzu in the Shimavala area back in the 70s. Now I'm revealing my age here.
Yeah.
And I think my older sister couldn't get herself around to saying 𝐂𝐈𝐃𝐑𝐙, and she would say Zuzu,
And it grew on you?
it grew on me. And
Wow.
when I went to school, I was told my name was 𝐂𝐈𝐃𝐑𝐙, so I had to learn that. And for a while, I had to try and separate the two. You know, at school I was known as 𝐂𝐈𝐃𝐃𝐙, and at home I was known as Zuzu. So when my friends from school came home, I said to my siblings and my parents, please do not let them know. Let's keep it official. But with time, you know, the two names are blended, and you know, I'm called 𝐂𝐈𝐃𝐑𝐙 or Zuzu, or 𝐈𝐳𝐿. I have an 18-year-old daughter, so 𝐈𝐳𝐿. So yeah, so many different names you can call me.
Oh, okay. We'll go with Zuzu today.
We'll go with Zuzu.
With your permission. Yeah.
So I know we've gotten you out of bed pretty early today to come do this show.
Not really.
Really?
Not really.
Is
I'm
it?
a runner, or a wannabe runner.
Is it?
And I run with 𝐈𝐳 Running Club, and most recently I joined Southside. So this is a group of runners that live on the southern part of the city and affiliated with Lusaka Fitness Squad, and they run from 4:30 or 4:20. So they're the ones that get me out of bed really early.
What distances are you covering?
They're covering crazy distances. Actually, I said to them this morning that I'd rather do a marathon than come on the show, because you know, I'm a little bit nervous with public speaking. A marathon actually sounds like a really good idea today. But they do crazy distances, really amazing runners.
𝐂𝐳 runners?
Yeah, 𝐈𝐳 runners, and then Southside.
Oh, okay. What distances do you cover yourself?
Well, this month is a challenge that I'm taking part in, to do 40 kilometers a week. So that's what I'm shooting for currently. But
Okay.
I've done 2 marathons, but I like the easy running. So even though I'm doing a marathon, it's an easy run, and we take our time and just enjoy it.
Oh, okay. So you like, slow pace at your own pace.
Yeah.
Cover as much as you can.
Yes, time on your feet.
Oh, okay.
Be outside, enjoy the fresh air, interact with friends. It's a community, it's a family. Exchange stories, get to know what's happening.
Oh, okay. That's brilliant.
I would like to take part in that.
I was about to say something like that, but
Of those intense workouts and all that, just take it easy.
Well, that's part of it. You also have to do some other, strength core training as well. So it's just not one. You have to incorporate other forms of, physical.
Wow, Zuzu, you almost convinced Crumbs.
You almost did.
Just that bit.
No,
Just that bit.
Just come and run, and then we'll see from there.
Is it?
Yeah.
Might be luring me down a heavy workout. No. Well, we'll try. So, where do these events happen? Where do you converge?
So 𝐂𝐳 Running Club is really ad hoc. It's a group of 30, 40 runners, and we meet anywhere and everywhere. We like to have a good time after the running, so lots of drinks and food. The South Side actually meets in the Makeni area, so Total Filling Station on Kafua Road. They start at 4:30 on Mondays and Mondays and Tuesdays from Total Filling Station, and then they do what they call hill repeats, so going up and down a certain incline just to get that strength going. So they're meeting various sites. I think if you look at Lusaka Fitness Squad website, they do have a website, and you can see how you can join the different satellite groups and be part of the running family.
Okay. Sounds good.
Interesting, right? Kafua Road, Southside.
That's your area.
Yeah. That's That's my. I'm not saying I'll be. That's
No,
the time
no,
excuse. That's the time I report for work.
We've got an evening class for you.
There we go.
I think I have a good 4 kilometers in me. I actually do a good 4
Stop
kilometers.
it, PZ.
Daily. I do 4
Come
kilometers
on.
daily.
That's good.
I have a witness.
Do you believe him?
Yes.
She had to think
She
about
had
it.
to look at me. She had to look at my body size. It's like, you don't
The
look
lie is somewhere
Okay.
All right, well.
It's a pleasure to have you here.
Yeah,
We're happy to have you here. But we're going to ask you some quick questions, okay?
Okay.
And we want you to give us just straight answer.
Okay.
We're going to do it quickly.
Okay.
Texting or talking?
Texting. Don't call me.
I'm just like that. Yeah.
Call me
Okay.
if it's urgent or important, but text me.
Okay.
Don't you hate it when someone calls you for something they would have sent a text about?
Yeah, why are you calling me?
You just like the sound of my voice?
Yes, yes. Maybe it brightens my day.
Well, what's your favorite day of the week?
Fridays. Yeah.
Okay.
Not because I get off work at 2 p.m. So even though Ciders officially closes its offices at 2 p.m., there's lots more going on, so we sometimes work late. But then I like Fridays because that's the one day that I set aside to spend time with my son. I have a 4-year-old, so I like to pick him up from daycare, take him home, and just interact and play around with him. And then it's also a day that hopefully my husband will be home early, and if my 2 older kids are back at home, be able to have some quality time Fridays, go out with friends as well. So I like Fridays.
Oh, okay. Besides the city you live in, what's your favorite city in Zambia?
In Zambia, I think I love Livingston.
Okay.
Yeah, I like for all the touristy sports and activities that you can get into, and then it's not busy like Lusaka. There's not so much traffic. It's clean. People seem to be more outgoing, friendlier, perhaps because of all the tourists that they get in. But it's just a very different vibe in Livingston compared to Lusaka.
Okay. What's the last song you downloaded?
I don't download songs.
Or streamed, let's say, in this case.
Streamed. No idea. I think I'm not conscious when I'm listening to music. Yeah. So
You don't get your phone and go to
I just go to
Spotify.
I just go to Spotify, and then I'll do like energy booster.
So like
and
a
then
playlist.
Yeah. So whatever they've put together as your energy booster or your wake me up.
Yeah.
Series, then I'll just listen to whatever that is. But if I'm going to go out and listen to somebody, I'll probably listen to Sam Smith. I love Sam Smith. Adele as well.
Oh, okay.
UK artists.
Yeah.
Okay.
All right. Here's another one. Would you rather be able to speak every language in the world or be able to speak to animals?
Speak to animals, I think. Yeah, I think there's so much going on in the world right now that the humanity has been lost.
Yeah.
I think kindness is not there. Being able to relate to each other in a way that always assumes the best in others is not there. We've lost a lot of that. So
Humans are so bad you'd rather speak to animals.
at a certain level, I do believe that I think to reset us all, perhaps being able to speak to animals and try to understand some of their reflections in terms of how we live might be able to change how we actually approach life.
Are you sure you want to talk to animals?
Yes.
With your job?
Especially with my job.
Do you like research? Do you like have guinea pigs and whatnot?
No, so we don't do that kind of basic science research.
Okay.
But then we do collaborate with others that do, because it's a pipeline. Somebody has to start it from the guinea pigs all the way to humans.
But imagine going to that side of work or your colleagues, and then these guinea pigs are just telling you, "We've got something to tell you.
Yes.
We're being mistreated here."
That's quite something.
That'll be quite a very, very interesting conversation.
Yes.
Yeah. Okay.
What's your favorite holiday?
I've enjoyed the last 2 years of COVID because we've explored the country more, so being able to go to the local sites. So anything that has hiking, outdoors, my dream holiday actually is to go up to Kilimanjaro.
Ah.
I want to hike up to Kilimanjaro. I just have to get over this sense of the cold because I don't particularly like the cold.
Oh, okay.
And then also the fact that there are no washrooms and you have to go in a bucket as you hike up Kilimanjaro.
Okay.
So that's what I'm trying to wrap my mind around. So 5 days of no decent washroom and the cold. So once I wrap my mind around that, I'm going up Kilimanjaro.
The ancestors did it, so
Yeah.
you know
Yeah.
we could do it too.
No, not for me. Just there. No, not for me. How long does it take you to get ready?
30 minutes.
Really?
Yeah, I wish Hope was here, then we could have that conversation.
30 minutes?
30 minutes.
30 minutes.
Wow.
30 minutes. How long does it take you to get ready?
About the same amount of time because I don't have to do much.
Oh, okay.
Yeah. So you don't do the extra, makeup. And
Yeah, all that extra stuff takes 30 minutes. That's what I'm saying. I wish Hope was here so we could have a conversation about
I think it takes like an hour for Hope
takes
to get
her
ready.
and how long it takes me.
Hope. Okay. I think at some point I'll call Hope.
We have to.
We'll have to call
We
Hope.
will.
We will call Hope. Yeah.
So on a scale of 1 to 10, how good of a driver are you?
10.
Really?
Yes, my father taught me how to drive many years ago, and it was lent off a manual car. And my father is or was a civil servant, so very methodical in his approach to things, very disciplined, very humble. So even just before he let me get into the driving seat, you had to go through this series of lectures and make sure you understood every bit of it. And he was very focused on courtesy to the other drivers. So if I get to traffic lights that are not working, I will stop and try and let all the cars that were there before me go before I go. But it doesn't work.
Oh.
So even though it doesn't work, I still do it.
I will bet my last penny a better driver than Promise.
Wait,
I will bet
I'm
my
a good
last-
driver.
I will bet my last penny.
Wait, even after the last drive we had.
I'm telling you.
Wow. Some friends.
You watch that show 1000 Ways to Die?
I try not to.
Well, get in the car when Promise is driving. You'll be in one of the episodes.
I'm not that bad.
That's what all the bad drivers say. I am not that bad. At what age do you want to retire?
So that's an interesting question. Retire from science? I'd say never. I think as long as my brain is functional, I don't get dementia or anything like that, I don't think I ever want to retire from science. Retire from what I do day to day, being in the office, perhaps in the next 10 years. And if I do retire, and when I retire, I know everybody says farming is your retirement plan, but farming is my current ongoing.
Oh,
So I love the outdoors. I love, like I said, I grew up on a farm. My parents still live on a farm, a dairy farm. So the outdoors and farming is something that's just second nature to me.
Okay.
Okay. So, last one here. Invisibility or super strength? If you could be a superhero, which one would you pick? Which one would you be? It would be your superpower.
Now you sound like my son. I want to be Spider-Man. Okay. I want to be Spider-Man. Like, okay, we need to figure that one out. I don't know. That's a hard one. I can't choose. I'm sorry.
Super strength or invisibility?
So super strength to do what?
Just to be strong.
To lift things and
Everything. Just be strong.
Then I guess to be invisible. Yeah.
invade people's privacy.
No, not for that. So maybe they don't bug me.
Wow. Are you that much of an introvert?
Text me,
Sometimes.
don't see me. Invisible Zuzu.
Sometimes.
Okay, so are you both an ambivert, or do you lean more to?
I think more towards an introvert based on the twos and assessments that have been done. Yeah.
Okay. All right. It was nice to to get to know this side of you. You know?
Well, I wasn't expecting it. I was going to get into science.
Well, we will get into science. It's the Red Hot Breakfast here on Hot 87.7, number one for news and entertainment. And today we have the Chief Executive Officer of the Center for Infectious Disease Research in Zambia, Dr. 𝐂𝐈𝐃𝐑𝐙 𝐂𝐈𝐃𝐑𝐙. She's allowed us to call her Zuzu for the show today. So it's the first time having you on the show, and it would be proper that we get to know a little bit more about you and the work you're doing at 𝐳𝐳. We know you are an infectious disease doctor and public health specialist, and you have been at the helm of 𝐳𝐳 since 2017, the first Zambian to hold that post. How's been the experience so far?
It's amazing that it's been since 2017. It feels like it's just yesterday. You say the first Zambian, it's actually the first woman to hold that position. And I'd like to emphasize on women in leadership, and I think it's important that more and more women take up leadership positions, particularly in public health.
Right.
You may not be aware that more than 75% of the health workforce is made up of women, and they also are the primary caregivers when it comes to health. But when it comes to taking up positions of leadership across different public health institutions, it's usually the men. So it's really important that we do highlight that more and more women need to take up leadership positions in public health and across different sectors. It's been a very incredible journey, lots of highs and lows, a lot of major accomplishments and celebrations, as well as low points and disappointments, anxiety and stress, roller coaster. Every day at 𝐳𝐳 something new is happening. But I'm really excited about it. I get excited about the science. That's one aspect that keeps the job ever new to me and keeps me getting up each morning to engage in the science and see and address public health priorities, not only for Zambia, but for the region and the continent.
When did this passion for science come up for you? Because you speak of it brightly.
I think it just grew on me. My mom was a nurse. She was the matron in the accidents and emergency room at UTH, so way back then. And I remember, walking up and down UTH, where casualty is. She was the matron there, and I think she must have run it like a military outfit. Yeah, you could tell from the way she made us make our beds in the morning and get those nursing corner angles into the sheets and into the bedding. So very, very regimented. So I think I was always around that environment, and I enjoyed it. And when I went to university, I went down the path of doing medicine. When it comes to branching into infectious diseases, it was really because of a lot of the despair that I experienced as a medical student from the HIV epidemic when the outbreak was at its highest, and having seen the loss personally from family, friends, and then also from patients that we took care of, and the impact that HIV had on them, that made me really go down the pathway of being an infectious disease doctor. I wanted to be the best medical doctor I could be that took care of people living with HIV. And in that realm, really got into infectious diseases and into public health.
Okay. Well, if you just tuned in, we have Dr. 𝐂𝐈𝐃𝐑𝐙 𝐂𝐈𝐃𝐑𝐙. She's the CEO of 𝐳𝐳. Let's get into our news headlines in 8.
Lines every second hour are sponsored by Swan Insurance Zambia. For you, for them, for life. Swan, for life.
Headlines at 8. The Resident Doctors Association of Zambia has described the suspension of full blood count testing at the University Teaching Hospital as a disaster that must be addressed immediately. Development activist Charity Musamba has expressed concern over the failure by government to raise the required funds needed to hold the 2022 population and housing census barely 2 months before the exercise commences. FIAN International Zambia says the decision by oilseed stakeholders to export 100,000 metric tons of soya beans is a positive development that will not only bring forex in the country but encourage production. A senior Ukrainian presidential aide has told the BBC that between 100 and 200 Ukrainian troops are being killed on the front line every day. South Africa opened their 2023 Africa Cup of Nations qualification campaign with a 2-1 loss away to Group K favourites Morocco at the Prince Moulay Abdallah Stadium in Rabat on Thursday night. And the headlines, we have more coming up at 9.
Zambia's award-winning and most trusted.
Wherever it leads, but remember, if you
That's Diana Rose there with Ain't No Mountain High Enough. People, our third presenter today. Zuzu.
Yes.
Yeah. We continue to have that conversation in my head. I'm trying so hard to just, for somebody that's just joining us, let me just say, before you make a lengthy post about us and social media, we were given permission by the doctor here to call her Zuzu instead of, Dr. 𝐂𝐈𝐃𝐑𝐙. Yeah, thank you.
One thing I have to say that I learned is that a leader never leans on their titles. So I do not have to go around and say I'm Mrs. Kaulu, Mrs. Muna Kaulu, and I'm very proud to be his wife. But I do not have to lean on that title of Mrs. or the title of doctor or title of professor. Your leadership or your personality, who you are, comes through in the way that you present yourself and not in your titles.
Oh, okay. That's very interesting. As we continue with our conversation, Cyrus recently celebrated 20 years in Zambia. What are some of the key milestones in the past 2 decades of working, in this country?
So lots and lots of milestones. I don't know if you're aware that you can actually prevent transmission of HIV to an infant. So an HIV positive woman who's pregnant or breastfeeding has the chances of passing HIV to an infant almost reduced to 0 because of science. And some of the science was done right here in Zambia by CIDES and its collaborators at the Ministry of Health and other internationals to show that antiretroviral drugs can actually stop that transmission. So just think about it, 20 years ago, when you had a lot of HIV in the community and lots of children being born with HIV. If some of that science had not been done then in Zambia, as well as in other countries that were doing similar work, we would have a lot of children born with HIV and dying from HIV. So the Sentinel work that was groundbreaking and was included in the WHO guidelines in terms of how to prevent HIV infection to unborn children being born to HIV positive women was done right here in Zambia. And it's such research that I think keeps me energized and passionate about my work. Last year I was reading the recommendations. I was like, these guidelines are not telling me anything new because this is what we're already doing. So I started looking at the references. And the references and the papers they are quoting are references that are papers that have my name, as well as the names of other researchers that I work with here in Zambia at the Ministry of Health, at CIDES, and the international collaborators. So WHO is sending out formative guidance for HIV prevention, care, and treatment, some of it based on work that's been done right here in Zambia. So how exciting is that? How do I package that and be able to, I guess, quantify what a milestone that is? I think it's important to recognize a lot of the research and work that has come out from this country.
When did we hit that milestone?
So, in terms of HIV prevention from mothers to children, on average now we're down to having transmission rates as a country of less than 5%. So there's a 5% chance or less if a woman is HIV positive and pregnant of being able to pass that infection to her child. And really that remains at 5% because of the missteps in providing access to people living with HIV, especially pregnant women, and ensuring that we get them engaged and remain in care before they get pregnant, while they're pregnant, and after they deliver the baby. So there's some gaps there that need to be closed to really bring that risk of transmission to less than 0%.
Okay. Now, in terms of actual investment into Zambia programming, how much are we talking about in the 20-year time space, and what informs those spending priorities?
So I think before I talk about how much we've spent over the last 20 years, I'd like to say that CIDES has more than 1,300 full-time employees. And these employees are doing various work around TB research, diarrheal diseases research, vaccines for some of the key diseases that affect children under 5, looking at prevention of cervical cancer screening, health system strengthening in the correctional systems or prisons. So you can imagine that over the last 2 decades, a lot of investment, particularly from the United States President's Emergency Fund for AIDS Relief, PEPFAR, through CDC and USAID have come to the country through CIDES, as well as other funding from the EU government and private donors. So roughly we've had about $300 million come into CIDES through the years, and this has been spent on priority areas that the government has deemed to be public health needs and interventions that CIDES can support them with.
Okay, let's get your views on disease profile for Zambia. Which are the leading cause of ill health and mortality in Zambia, and why is that so?
So we've spent a lot of time looking at HIV, tuberculosis, because those are 2 diseases that cause a lot of morbidity and mortality. You will know that malaria is another one of the key diseases the government or the Ministry of Health focuses on. It hasn't been a sweet spot for CIDES. We haven't really gone into malaria research. There are other collaborators in the country that are really focused on malaria research.
Is that deliberate?
It's because there's nobody who's passionate about it within CIDES. We always have to have a champion on a certain disease within our institution. Otherwise, strategies or initiatives for that will fail. So you may have a collaborator with whether in country or internationally coming to us and saying, hey, look, I want to work on malaria. That's right, that's fine, but who within CIDES is going to carry the flame for malaria and champion it and make sure that it's really ingrained and part of the CIDES research portfolio. Otherwise, you have what they call parachuting. People come in and essentially use you and then go off and take off that work somewhere else. So we really want to make sure that whatever we work on, there's somebody who champions it within the organization and is passionate about it and ensures that it's in line with government's priorities.
Is it easier to find champions when you're dealing with a disease that has, let's say, more funding?
Of course, it's easier to do that. But then we've also worked in areas where there wasn't a lot of interest. We spent a lot of time back in 2010 to 2014 pushing rotavirus vaccinations for children under 5. So we know that children die from diarrheal diseases. They're quite common, and some of these are viral infections. And there are vaccines for those diseases. So part of the work that was done was to try and show what diarrheal diseases or the etiologies of those diarrheal diseases are in the under 5 population, and then try and figure out, do vaccines work? So vaccines that have been used in the Western world or in the global north, are they effective in our setting with our population, given our context and some of the elements that we expose ourselves to? So we're able to show that, and working with the Ministry of Health, we're able to introduce the rotavirus vaccine into our expanded program for immunizations for children. So we look at what is of public health priority to the government and what is missing research or information around it, and then trying to produce the science or the literature to support government policy formulation as well as program implementation.
Okay, so you mostly work on TB, HIV, and more recently COVID-19. These are decades-old diseases, TB and HIV to be specific. Do you see eradication of these diseases in your lifetime?
So eradication is complex. Like, do you mean will they be totally done away with? We will no longer have those?
Is it possible?
It's possible, and actually one of the new initiatives I've been working on is towards a cure for HIV. And I want you to think about it. Cure for HIV. What does that mean? What does that look like? We've always been told that there is no cure for HIV. People will have to live with it until they die, either from HIV itself or from something else. But the possibility of an HIV cure is there within our lifetime. So in as much as we may be talking about eradicating these diseases, I think the onus should be around how do we have policies in place or incentives in place that secure the health of Zambians as well as Africans. A lot of work has to be done in terms of bringing in the next generation of researchers, of medical care providers, of whatever else is needed to ensure health security for the country.
The hot station number one for news and entertainment, which you're listening to. RHB, we're going all the way up to 9 in the morning. We're having a chat with the SIDA CEO. We're calling her Zuzu this morning.
Yeah, she allowed us to do
that. Yeah, so we'll continue having this conversation right here on your hot station number one for news and entertainment.
RHB.
Your hot station number one for news and entertainment, which you're listening to this morning. It's 08:24. We continue having breakfast with Zuzu on the show, and we continue having this looking at the milestone that CIDAS has achieved in the 20 years of being in existence in Zambia, and you shared some milestones and what works you're doing. Let's look at the relationship between CIDAS and the Zambian government through the Ministry of Health. I know you provide a lot of health system strengthening to the Ministry of Health. Which are some of the priority areas when it comes to that?
Okay, so our goal is always to be seen as a permanent resource to the Ministry of Health in terms of being able to support them with the science as well as the technical assistance needed to think through some of the public health priorities that the country is battling with. I want to talk a little bit about some of the health system strengthening work that we've done with within the correctional services, working with the Ministry of Home Affairs as well as the Ministry of Health and the Ministry of Community Development and Social Services. One thing that I'm really passionate about is ensuring that incarcerated people have access to quality health services. And even though I'm so focused our work has really been focused around HIV and TB within the correctional services and how to ensure that there's continuum of services to incarcerated individuals and upon their release. Some of our recent work that we're just getting ready to disseminate has shown that the women that are incarcerated and come out of the correctional services actually falling through the cracks. They're no longer continuing with their HIV treatment because they're stigmatized having been in prison or correctional services. They're stigmatized because they were found guilty of a crime and they have HIV and just trying to get back into society, they're really battling with that. So we no longer are able to engage them with their HIV services or TB services. So that means that they have poor health outcomes that is detrimental on a population level. So we're really passionate about the work that we do with health system strengthening within the correctional services. And another thing more recently is around vaccination. We've been talking COVID is the cold weather now, cold season now. We know our numbers are low, but it doesn't mean that we relax and not pay attention to vaccination or other preventive measures as outlined by the Ministry of Health. So we've been working with them to support the COVID vaccine rollout. We received funding from PEPFAR through CDC or USAID to support those initiatives. We've also been working with Gavi and other funders to support the supply chain of the needed vaccines in the country. I want to highlight some of the work that we've done around cholera. I know there was a cholera outbreak in the country a few weeks ago. It didn't receive as much hype in the community or in the news. And I want to take you back to cholera outbreak 4 or 5 years ago. Everybody seemed to know about it.
It was like 2018?
Yes,
That
those,
happened?
Took a lot of lives.
yeah, it took a lot of lives. But what you don't understand or what you don't know is that behind the scenes, we were working with the Ministry of Health to understand what are the cholera hotspots, what's going on in those hotspots. Can vaccines actually have an impact in hotspots? And there was a drive that went on vaccinating individuals in the hotspots so that with time, the incidence of these outbreaks reduced. And with this recent cholera outbreak, it left people in the cholera world in Zambia asking, is this truly a cholera strain? What's wrong with this strain? It hasn't hit us. But that's because a lot of work has been done behind the scenes. I just supported the Ministry of Health in terms of understanding how vaccines for cholera work in our community, in our population, and just getting communities vaccinated with the cholera vaccine.
Okay, I just want to talk to you about the COVID vaccine. I know the government has embarked on an ambitious campaign of having 70% of the population vaccinated by the third quarter. Do you think that's a realistic objective?
It's an ambitious objective and one that we should strive for. It's still disappointing and frustrating for us working in this area to see vaccine uptake remain low. There were various reasons for it. Initially, there were no vaccines, and then a lot of myths and misconceptions came through that made individuals within our communities hesitant. And when we don't have those high numbers, those surges, I think people relax and they don't pay attention to COVID and the vaccines. And then when you have the surges, you see this rush for it. But I think everybody should be engaged and work with government, with the Ministry of Health to try and reach those ambitious targets. COVID still remains a present danger for us, and it will impact our economy, our social connections, our income, if we do not stay on top of COVID.
So with the current rate of vaccinations, do you think that 70% is achievable by the third quarter?
It will take a lot more involvement, a lot more push and adoption by community stakeholders. I think the Ministry of Health has tried to decentralize this process as far as possible, but individuals need to make those personal decisions. There's some work that we've been doing with our social and behavioral scientists to actually understand which segments of the population are hesitant to the vaccine and why are they hesitant. And some of that work has been translated into the information, education, communication materials, into some of the programming that you're seeing. So hopefully the uptake of vaccines continues to improve, even in the absence or the current surge of new COVID cases.
Okay. I want to, throw something at you, and I know this is ongoing. We now have the ongoing mass recruitment of around 11,000 health workers. To what extent do you think this would go towards achieving better health outcomes?
It's obviously must be applauded that we're getting a new stream of 11,000 health workers. A lot of people say, that's a lot or that's not enough. But I'd like to take a step back and say it's not about the numbers, it's about the quality. So what is the quality of health workers that we're recruiting, and what is the quality of the current and present healthcare workers that are working within the facilities or within the communities? We need to reset and focus a lot on quality of what we do and take pride in what we're doing and be passionate about whatever careers we've taken. And a lot of investment will have to be done both in pre-service training of healthcare workers as well as in-service training to look through and improve the quality of the services they provide. We've worked with Lusaka Provincial Health Office and the Ministry of Health Quality Improvement as well as Quality Assurance Directorates to try and better understand what is it that keeps our patients disengaged from HIV services. And one of the things that came through was that patients, actually there's one paper that we published in peer-reviewed journal, that was a direct quote from an HIV positive woman who had disengaged from her clinic and no longer taking her drugs, and her quote was that they care rudely. So they being the healthcare workers. So trying to take that back to the healthcare workers to say, this is what your patients are saying. What is it that you can do to improve that engagement between yourselves and your patients or your clients? And then working with the health system to also understand some of the barriers and challenges that they have that result in them caring rudely to their patients. So a lot of those quality improvement processes are underway, being led by the Ministry of Health, and we've been providing them with some of the qualitative science or research findings from those dialogues that we've had with patients as well as with healthcare providers.
Okay. Now, as of December 2021, 88% of people living with HIV in Zambia were on antiretroviral therapy. It appears we are well on our way to attaining 90-90-90, an ambitious treatment target to help end the AIDS pandemic. What's your view on that?
It's remarkable, and kudos to everybody who's worked in this sector over the last 20 years, from the government to our funders, through various agencies, primarily through the Global Fund to fight AIDS, tuberculosis and malaria, through PEPFAR and its agencies of CDC and USAID and other funding agencies. When you look at it and look at some of the results from the different districts in the country, you will see that actually some of them are way past 90-90-90. The Ministry of Health is in the processes of finalizing its population impact surveillance study, where they'll be able to tell us what the prevalence rates are, what the incidences are, and whether we're truly at achieving those ambitious global targets. But for the most part, we're doing really well, and we should be proud of the work that we've done.
Okay. I want to, just find out a few things. I want to get a comment from you. What we earlier in the week we got news that we're having around 4,000 infections in a week. That's statistically
Among young girls.
Among young girls. What's your take on that?
It's disappointing given where we are with the epidemic and what we know. The science is clear in terms of what you can do to prevent HIV infection. There's a lot of social and behavioral factors, obviously, that influence how individuals will respond to the interventions that are available. One of the sentinel works that came out of Durban by a research organization similar to CIDRS, known as CAPRISA, was to show this cycle of HIV transmission within their population, because their HIV prevalence amongst young girls is around 30%, so really, really high. And what they were able to show was that older men engaged in sexual activity with younger girls, whether it was transactional or whatever it was, and then the younger girls got infected with HIV and then infected the younger boys, and then the younger boys then infected other girls or older women. So it was this vicious cycle that is very difficult to break. But we have ways in which you can prevent HIV. I remember as a medical student taking care of a patient who had AIDS and trying to get an IV access on her, and I ended up getting a needle stick. I had nothing to prevent me from getting HIV besides squeezing the blood out of my finger and washing my hand. But now we have what they call post-exposure prophylaxis. We have pre-exposure prophylaxis. So if you're at risk, or you think you may expose yourself to a partner who's HIV positive, you can get onto drugs that really reduce your risk of getting HIV infection. And we know that ART, just taking the HIV medicines, do reduce your viral loads to rates that make the risk of you transmitting HIV really, really low. So there are ways in which we can use to reduce risk of HIV infection.
Do you think we should start having this conversation? Because obviously cultural norms and everything to do with our culture in Africa, there's always controversy when you say talk about sex and how to be safe with your children. But do you think the conversation of PrEP, do you think we should start having that conversations with young people, the young girls, seeing that we have a stat that shows that 4,000 of them are getting infected every week?
So conversations are already being had. I think conversations need to be had with within communities, engaging the relevant community stakeholders, like your Manachimbusa, your church elder, your pastor, your traditional healers, for them to start to understand what this discussion is all about. There are what are called dreams centers, and these are centers across various districts in the country that are essentially safe spaces for young girls and to provide education to young girls, including PrEP. And what is happening in these centers is really empowering girls to be able to know how to prevent STIs, including HIV, how to prevent pregnancies, and how just to be healthy individuals that can contribute to society. They are in no ways encouraging promiscuity or telling girls to go out and have sex. What they're trying to do is educate and empower girls to really take control of their own lives.
Okay. We're going to take a quick break, and when we get back to continue our conversation, I want to ask another follow-up question that I'll have you think about it, because we've heard myths and that there's a cure out there when it comes to HIV. But I want you to answer that right after this.
HB. It's proudly sponsored by 𝐂𝐄𝐎 Enterprises Limited.
I was in California 2 months ago, and I met with Bill Gates discussing the same thing.
Yeah, we saw the pictures. Yeah.
Yeah. There's amazing work being done, and the cure is coming. It's just not coming tomorrow, though.
Will it come in our lifetime?
Yes, it's coming.
Yeah?
Because I have so much faith in scientists. With the way the COVID-19 situation has been dealt with, well, just the progress that has been made, and many other things. I always question HIV because it's been there for a long time. For a long time. How unique is this virus that we failed to beat it?
It mutates.
Decades after decades.
It mutates, it changes, because I think now everybody knows about variants and mutations.
Sorry?
So it also has variants as well.
Yeah, it has variants, it mutates, it's able to get systems to drive.
314-387 or +260-977-314-387. Instagram, Perfume Corner 1, Facebook, Perfume Corner, or visit us Shop 6 Freeway Plaza Mall, Chachacha Road, next to Society
Very
Business
smart
Park.
virus, huh?
It's the Blue Band Good Start Bonanza, and we want
Viruses
to reward you
are
with cash and some exciting prizes. Just buy tasty Blue Band margarine, which is fortified with vitamins and omega-3 and 6. And send a picture of your receipt via WhatsApp to 0771-701-380 and stand a chance to win your share of 200,000 kwacha. Remember, the more you buy, the more chances you have of winning. Blue Band, grow happy and healthy kids.
Yes, man.
The news app is synonymous with reliable service delivery,
I'll give it to you for
and
that.
we have kept true to it.
Ah,
When choosing a
once
taxi
I got
service,
something,
make sure it's punctual,
once
safe,
they show me
comfortable,
that, the moment they just feel
cost-effective,
like that,
and most
it'll be the
importantly,
same prescription.
trustworthy.
That is,
Because what good is a taxi service if
until-
you can't count on it?
sometimes,
Download
so
the
bad.
Zamcab app today and experience Zambia's best taxi service ever. For more, visit zamcabs.com or Zamcab247 on Facebook. Email info@zamcabs.com or call us on 0760-444-444. Yawonse, yafika. Zamcab, yawonse.
The Department of National Registration, Passport and Citizenship is calling upon all parents to register and obtain birth certificates for their children within 30 days after the occurrence of a birth in accordance with the Birth and Death Registration Act, Chapter 51 of the laws of Zambia. Remember, a birth certificate is the first legal identity document that every child is entitled to and is free. It is proof of age and place of birth and can be used to protect children from age-related abuses such as child marriage, child labor, defilement, and child trafficking. The requirements are as follows: original record of birth from the hospital, photocopies of national registration cards for both parents, and duly completed notice of birth form number 8, which can be obtained from the nearest office of the Department of National Registration, Passport and Citizenship, or the nearest health facility which has a birth notification desk. This message is brought to you by the Department of National Registration, Passport and Citizenship with support from UNICEF.
We just don't need like it needs to be on off
Yes, due to popular demand, get 20% off on all copper batteries for the month of June. Terms and conditions apply. Hurry whilst stocks last. Automatic equipment, cause you deserve quality.
RHB is proudly sponsored by 𝐂𝐄𝐎 Enterprises Limited, a part of every home.
The hot station, one for news and entertainment that you're listening to. We continue having breakfast here, and we continue our conversations. Obviously, we're going over up to 9 in the morning. Before we broke off, that myth, or is it true or is it a myth? Is there a cure for HIV out there that's being given from the continent?
So unfortunately, there is no HIV cure. All the stories or reports that you've seen across whatever media that you look at, as far as I'm aware, there is no cure for HIV. But there's a lot of work that's been done to make a cure available in my lifetime. And I'm 100% sure that this will happen within my lifetime. A cure is likely to be on the continent in the next 10 to 15 years. There's a lot of basic science research that's underway, and it's using a lot of different modalities or theories, but the most promising one is gene therapy. So being able to change some of the genes in the way that will respond to the HIV virus that will allow us to totally wipe it out. The HIV virus is a very clever, sneaky virus. It has places that it hides within the body known as reservoirs, and these are our lymphoid tissues, our brain tissue, so areas in which we can never really get to. And the current therapies that are there really target virus that is actively replicating or reproducing, so able to destroy that. But once the virus is sleeping in its nice reservoir, it's not replicating, and again, some of these areas don't get enough drug levels to be able to kill off the virus that's in that state. Progress has been made for sickle cell disease. Sickle cell disease is a genetic disease that affects mostly Africans, and I think everybody in Zambia should know somebody who's had.
Yeah, I had a friend growing up who had that. Yeah, he passed away.
Yes,
sadly.
and they die. A lot of them died before the age of 5. But there is a cure for sickle cell disease, but it costs at least $2.6 million in the US. And this is a process that you don't just do at the snap of a finger. It's a long, protracted process, but people have been cured from sickle cell disease. So using the same type of technology from sickle cell disease is what's now being proposed for HIV. And I am working on a technical working group with some other collaborators, and what we're trying to do is ensure access to sickle cell disease cure as well as HIV cure here on the continent. Because what happens is that you have these therapeutics or diagnostics or cures, but they're only available to you in the Western world. There is no way we'll be able to do what they're doing for sickle cell here in Lusaka, Zambia. But sickle cell is not there it's there in America, but not to the extent that, to the numbers that we have here on the African continent. So we're working with researchers, as well as funders, as well as regulatory pharmaceutical companies to make sure that we have a product. Once it's ready, it will be accessible here on the African continent where the burden of disease is.
Okay. All right. Now, with diminishing household incomes, there's a threat that risky sexual behavior, especially among young girls, might erode the gains recorded so far in the HIV response. Do you share those fears?
I do, and going back to some of the earlier conversation where, you know, PZ was talking about 4,000 new infections in young girls, a lot more can be done, like I said, engaging with the relevant stakeholders and being able to have those difficult, uncomfortable conversations amongst ourselves. You know, it's difficult for parents to talk to their children, their girl child, about sex and how to protect herself from pregnancy or an STI or HIV. And, you know, an adolescent time is a period of exploring. I think all of you can relate to that. Yeah, and you're not going to pay so much attention to what your mom is telling you or what your dad is telling you. So understanding some of the dynamics that are going on in these young girls and boys and being able to, I guess, download it to their level and be able to have frank and open discussions and letting them have access to, say, for instance, the DREAMS facilities that I talked about. And they're all over in our communities that are set up specifically to enable the girls to go in there and learn from their peers, as well as a professional person to get real information in terms of what's true and not true. A lot of times we're relying on social media to get our scientific input, but you know what's on social media half the time is just crazy nonsense. You know.
Yeah. So how accessible is PrEP for
Very,
someone to be
very accessible. I think.
Is it given out for free?
Yes.
Okay.
Going to the public health facilities, you'll find that. I think some of the work that needs to be done is to get it away from the health centers. Like I said, again, the DREAM sites do have access to it. So making it convenient to you, you know, the same way we've tried to make the COVID vaccine convenient for anybody. You know, go down to the shopping mall, you find it. Ciders has piloted these vending machines. You go in there, punch in one or two things, and the vending machine will give you what we at one time we thought it would give you PrEP, but what it does now, it gives you a condom, information where to get PrEP, and where you can access your contraceptives. So I think we need to get to a stage where you have vending machines that can dispense these things in nightclubs, in shopping malls, at the church. I mean, I don't know why we want to separate, you know, talk around sex from the church. It's not that we're promoting promiscuity. It's trying to ensure that individuals remain safe and engage in safe sex when they're ready, not when they're coerced or going into it with half-baked information.
So how exactly does it work? Do you take it every day, or is it before sexual intercourse or after? How exactly are the mechanics of this?
So right now what we have are oral tablets that you have to take daily. Yeah, so you take it daily. When you think you're going to be at risk, you take it throughout the whole period. But you have to do this in consultation with your provider. They will tell you exactly how to do it. You will take it for a period of time. You have to get an HIV test done to make sure that you're HIV negative, because we don't want to give you PrEP when actually what you need is treatment. Yeah, so there are those things. And then what's available now is the long-acting antiretroviral drugs that can also be used as PrEP. So you get an injection that lasts you for 4 months or 6 months. We're still working through the modalities, but it is available in other countries, and the Ministry of Health is looking into it. And hopefully that intervention will be available both as treatment and as PrEP in the country.
So are you encouraged to use a condom still?
Yes, you are, because it's just not HIV. You can get pregnant, you can get syphilis, you can get other sexually transmitted diseases.
Yeah, because some people might feel it's a substitute.
You know, it's like a license to just...
No. And again, education is needed. Right information has to be given out. It cannot be half-baked information that a teenager whispers to another teenager that whispers to another teenager, you know, it will be lost in translation, and this could go seriously wrong for society. And we're not trying to go down that pathway.
Okay, I know we're getting to a close of our show, but let's quickly look at medical research, an area that your organization is focused on. Could you tell us about some ongoing research work which could be of public interest?
So we have a clinical trials unit, and this is a really robust setup that allows us to engage in multi-site, multi-country research studies, and some of them actually feed into the U.S. Food and Drug Authority because they're looking at interventions or drugs that would be used for HIV treatment or HIV vaccines and TB vaccines. So currently we have clinical trials that are focusing on HIV vaccine, TB vaccines, as well as new TB therapeutics. We do have clinical trials around E. coli. So E. coli and Shigella are bacteria that cause diarrhea. And like I said before, these are quite notorious, especially in young children. So vaccines that can prevent those diarrheal diseases. So we have a whole setup of really brilliant scientists, mostly Zambian, majority Zambian, collaborating and working on this. Some are doing their their PhD studies, some are newly graduated from their PhD studies, and they collaborate across a network of different countries, have really good scientists and mentors that are helping them in their academic or research growth.
Okay. Now, as we draw close to the end of the interview, in your role as CEO, what kind of disease profile would you like to see when your time to retire arrives?
Not even my time to retire. I think what I'd like to see even right now is not a disease profile, but investment in science, investment in research, in mathematics, in investment in young Zambians so that they take on this profession of medical research or medical science, so that we're able to better secure the health of Zambians. Just look at the remarkable work that came out of South Africa with COVID. South African researchers working with their government were able to feed the entire globe groundbreaking work on COVID variants that influenced how we then thought of COVID, how we thought about vaccines and isolation and travel bans. That was done in South Africa. What is different between South Africa and Zambians? So I think what I'd like to see is investments into ensuring that we have the infrastructure, the resources, and resources really focusing on the people that can do quality research that feeds into any regulatory body, be it in Europe or in the US or wherever.
Well, you've given us a lot of information on the show today. Where can people find it, in their own time to just read up on all of this?
So they can go to our Facebook page as well as our web page. They can come through to the CIDR's offices. We have some offices across different cities and towns. I'd love for them to come through to the CIDR's Central Laboratory. It was the first clinical laboratory in the country that received its international standards of operation. So we worked with government then to get their clinical laboratories to reach ISO accreditation. So it's world-class lab. It doesn't look like it, but the work that's being done in that lab is phenomenal. I want to say that, for instance, PZ, you come into our lab asking for a full blood count. The way the technicians would treat your sample is the same way they'll treat a sample from a research participant that is going to feed into the US FDA drug approval process.
Okay.
So my technicians put quality as number one. So, I don't think there's any other lab in the country that places so much emphasis and has invested millions of US dollars just to ensure quality of testing and results that are coming out of that lab. So irrespective if PZ walks in or it's a research participant walking in, you're assured of the highest quality of laboratory testing and results. So do check out our social media pages, come over to our offices, give me a call.
Are you sure?
Yes.
A call?
Yeah.
Not a text?
Okay, give me a text.
Thank you.
Give me a text and give my assistant a call, who will then text me. Yeah.
I'm sure your technicians will be walking with their heads held high.
I work with remarkable Zambians, exceptional Zambians, really intelligent. They make my day going in a pleasure. Like, you have no idea the science that they do, the work that they do, and it's remarkable. And it's happening right here, being done by Zambians for Zambians, making it its way into global policy documents. There's no better pride or joy for me.
Okay. I did promise you that we're going to have a good conversation, right?
Oh yeah.
We did.
You see?
We had a wonderful conversation.
Yeah, so much easier than running a marathon this morning. I was saying I'd rather run a marathon than run a show.
Well, we had a great conversation with you. And just lastly, just one point. Do we have another wave of COVID coming? Is there any information on that?
So we're anticipating a wave. We're anticipating one in May, June, July. The numbers are slowly there, but I think also people are not testing. You know, they're taking it as a common flu, and perhaps we have enough immunity going around that it's not as bad. But again, if people can get vaccinated, continue to adhere to all the MOH guidelines, that's the best way to go. We really had a tough time last year at this time, and nobody wants to go through that again.
Oh yeah. Well, thank you so much for joining us on the show today.
No, thank you.
It's been fantastic.
Thank you so much, and I'd just like to say a really big thank you and acknowledge the funders that I've worked with CIDES over the years, particularly from the US government through CDC and PEPFAR, through the Bill and Melinda Gates Foundation, through EDCTP, Gavi, Global Fund, the Ministry of Health. We would not be the CIDES that we are today if it was not for all these different funders who have believed in the work that Zambians are capable of doing and who've supported us throughout the years. And then just lastly, to thank the CIDES team that have been holding me up. They think I lead them, but truly they lead me and carry the vision of the institution in ensuring a healthy Zambia. So thank you all.
All right, that's our show. We're back on Monday.